on my heart, and I want everybody to benefit from it. Okay, so so in the next 2 hours, we're going to be online. Okay. In the next 2 hours, we are going to be online. So I need you to dedicate your next 2 hours for this class. Okay. Good evening, Evelyn from Accra. Blessed be the Lord. Name for my crowd. Right. Let me see if everything has been connected now. Then we start. Yes, so very much for me. It's 1:13 p.m. at my end. So I think we can start now. Hey, Wesley, how are you doing?
I'm fine, please. Please, how are you doing too? And how is New York?
Feeling cold here. The weather is very cold compared to New Mexico.
Okay.
It's crazy here. So,
We are keeping the place, but we will soon join you, okay?
yes. Yes. All right. Hurry up and come.
Hey, I can't wait.
Where did we get to last week? Did we do Kawasaki?
No, please.
We ended here. I remember we did the right to left, left to right, pediatric conditions, heart conditions. I'm not sharing
Please,
the
that
pic.
was where we ended. We did the obstructive discordance.
Yes. Okay. So we saw this. We did this. I remember the pediatric. We saw this. Then we spoke about the the right to left and the left to the right. Okay. Or the right to the left cyanotic and the left to the right acyanotic congenital disorders. Okay. We saw all these ones. Okay. So let's continue with Kawasaki. Mm. Kawasaki is a vascular problem. Okay. Mostly the arteries. Okay. So kind of an inflammation. Mm. It's a generalized inflammation of these vessels. But the one that mostly gets affected is the coronary arteries because it causes what aneurysm. It makes it swell. So the other time I did, I don't know if I've posted it, the difference between aortic dissection and aneurysm. So you know aneurysm, the word aneurysm. Yeah. So a swelling, a bulging out of the blood vessel. Okay. Yeah. So we have the signs and symptoms. Uh, we have an acronym for it, the crash burn. Okay. So if you look at the, yeah, we have the crash burn. Please mute yourself. Let me make the admins. Okay. So the admins are made co-hosts. Okay. So that they will be answering questions and also filtering the noise in the background. Okay. Yes. So that means, right. So if you take the crash burn here, mm, for vasculitis, these are the cardinal signs and symptoms. The crash burn, the crash and the burn. Sorry. So we have the conjunctivitis, the rashes on the skin, adenopathy, especially cervical, on your neck, strawberry tongue. Yes, the blood vessels are so swollen, especially the arteries. Mm, that, when you take your oral mucosa, sometimes you see some of the vessels there on the tongue, very red. Okay, strawberry tongue. The hands and the feet swollen. Okay, yeah, that should tell you that no, because of the inflammation, fluid is shifting from the blood vessels to the interstitials. So you see the extremity swellings. Okay. This is not, yes, you can see the same signs and symptoms. This one. Uh-oh. Yeah. You can see this one in venous insufficiencies. Okay. Or heart failures and all those stuffs. Yeah. But here too, the problem here is not about blood is not able to flow back to the blood vessel, to the heart. That is causing a pooling. No, this one is an arterial inflammation and it's causing fluid, the plasma, to shift from inside the blood vessel to the interstitials. So you should know. Okay, so Kawasaki fever too, that will last for more than 5 days. You've taken paracetamol, you've taken all these antipyretics, but still the fever is still there. So, okay. We do immunoglobulins and aspirin for treatment. So that is what you should know. We do, uh, so that is what you should know. Okay. Did we do rheumatic fever last week? Mercy, do you remember? We did it. Okay. Right. So let's look at heart failure in children. Yeah, children to their heart can fail. Mm. Before your heart will fail, there should be a problem first. There should be a cause first. Okay. So that is what you should know. Heart failure will not, you won't just wake up and the next moment your heart is failed. No, it's a journey that started from somewhere, and the end part will become heart failure, or yeah, it will become heart failure. So that is what you should know. So some of the causes for children are congestive heart diseases, and cardiomyopathies. Okay, there is a difference between these two. So take note of that. Congestive heart disease, we've done it. Okay, and cardiomyopathy. Somebody was born with an intact heart. Okay, but as they are aging, mm, their heart begins to develop so many issues. Okay, there can be a blockade. Some of the muscles can die. Okay, it's a myopathy, a group of, it can be one problem or it can be a group, okay, affecting the heart and its structures. We call it cardiomyopathies. Okay, look at the signs and symptoms. So if you take the heart, like this, mm, if you take the heart like this, okay, so if you take the heart, we are talking about heart failure, the ventricular side. The ventricular side is failing. The strength is diminishing. Okay. The ability is shutting down. So if the ventricles are not able to push blood out of their chambers, we have something we call ejection fraction, EF. Ejection fraction. Okay. Now, the the upper chambers have brought 2,000 mils of blood to the lower chambers. Okay, for example, the lower chambers must contract to push the blood out. But now, because of this ventricular failure, because of the problem here, the ventricular muscle failure, it cannot push all the blood out. Okay, so it was only able to push 500 mils of blood out per hot cardiac output, remaining 1,005 inside. Okay, remaining 1,005 inside. So when this happens, we will say that the heart or the ventricles are not living up to expectation. They are not able to push enough blood to the system. Okay. So it is our duty to what? Calculate the percentage. So we'll do a certain procedure we call the echocardiography. Echocardiography. Okay. Yes. So we do an echo. And the echo should help us to diagnose what is going on. Sometimes also help us to know if there is any disease affecting the heart. Okay. And also help us to know the amount of blood that pumps out of the heart per cardiac output. And lastly, it will convert that amount into what? Percentages. So this percentage is what we call what? The ejection fraction. Is English. Eject. So how much blood was the heart able to eject out of the ventricles. Okay. And yes, the atrium brought 2,000 mils. So 2,000 mils will become the denominator. We did this in primary school, so don't forget. The 2,000 mils became the denominator. But the echo has revealed to us that only 500 was able to leave the heart. So when we take this fraction, anytime you hear the word fraction, it means we are talking about two numbers or two indices, where one will be at the top and one will be at the bottom. So always the bottom is the reference point, or called the denominator, and the top is the numerator. Okay. So out of this fraction, or out of this reference denominator, how much blood came out of the body? That's what we call what the ejection fraction is, always in percentages. So take note of that. Okay. So when you are managing a patient, you got a patient. Let's bring it back to let's make it more practical. I have a patient who is having history of heart disease. Okay. He has a history of myocardial infarction. Okay. Myocardial infarction. This patient has come to the hospital, okay, with pedal edema, 1, 2, difficulty breathing, okay. My saturation is maybe 88, between 85 to 88. Okay, yes. Then pedal edema. Okay. This patient has come to the emergency room. Okay. You don't know this, but once you saw this history, myocardial infarction, or any history relating to the heart, okay, that one should click your mind that, hey, this pedal edema I'm seeing with all this fluid dyspnea going on with saturation between 85 to 88, that should tell me that is it the heart that is not able to pump blood out? Okay. Is the patient having heart failure? It's showing you all the signs of heart failure. Okay. So you now caution yourself that should I give IV fluid or not? Okay. Now, the IV fluid you're gonna give, you have to be careful with it. Some doctors will even ignore IV fluids because you don't know the status of your heart. So sometimes, sometimes they will hold on with IV fluid and put the patient on what? On they will request for cardio cardio uh, echocardiography, echo, yes, so that they manage the patient. Okay. So if you don't know the ejection fraction, the EF of your patient, be careful with IV fluid. Those who are working on the medical surgical ward, okay, sometimes too, you know your ejection fraction, but just be careful with your IV fluid, especially the intra how do I call it? The isotonic solutions. That one will stay inside the blood vessel. It will not move to the tissues. Okay. Yeah. So don't go and overload somebody's heart if you don't know the strength of the person's heart. Okay. You that you are listening to me, whichever way you are listening, whether through YouTube, whether through Facebook or wherever. I mean, do you know your heart, the ejection fraction? you know the ejection fraction. If you don't know, be careful. I mean, with IV fluids, otherwise you will push more pressure and load on the heart to carry. Okay, thank you. Now, we have types of heart failures. So let's go back to our ventricle. We have the right side of the ventricle and the left side. This right side is connected to the vena cavas, like this. Okay. And they are at the same time connected to what? The pulmonary vessel, okay, or pulmonary artery. Okay. This is the left side. This left side is connected to what? It's connected to the aorta. Let me put the aorta here. I don't want to make a mess here. Okay. The aorta. And at this side too, they are connected to what? The lungs. So this is the right and the left side. Okay. Blood has gotten here 2,000 mils. Something has happened to the left side here. It is not able to move blood out of what? It is not able to move blood out through the pulmonary arteries. Okay, so this blood will be stuck here. But you've forgotten that every moment blood is coming from the vena cava through the right atrium to the right ventricle. Okay, so if you have collected blood in your chamber and you are not pushing it, you are not moving it, like moving it to another chamber, you're going to cause what? Flooding. What we call flooding or pooling, a pool, swimming pool, or a lake. Yes, lake. A water body that does not move. It's stuck. It's a lake or a pool or a flood. Okay. Yes, over here. So it will start flooding, 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 flooding. Now it will continue to the right atrium, flooding, 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 then move to the hot vena cava. Okay, so flooding, 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 flooding. It will get to this junction. Some will move to the head where it is passing back. It's a back flow of blood. So some will move to the head. Where is it passing to? Okay, how do we call it? The jugular veins. Okay, the jugular veins and all these subclavian veins. They will move. So subclavian you can't see with your naked eyes, but the jugular vein, every human being, you can see it. Okay, so the flooding will be more visible in the jugular veins. So one, flooding, flooding. If you look at the patient's neck, you will see what? A distended jugular vein. Okay, let's try and palpate it. The jugular vein is full of blood. Okay, so what happens? We will what? It will be kind of bounding and all those like, but distended jugular vein. Okay, now let's go. The amount of blood that will also pass through the inferior vena cava will also go, and it's coming straight to your legs. It will flood and come to your legs. Now we are on your legs. Okay. Flooding, flooding, flooding. It will get to a time, it will start stretching the walls of the veins, the vessels. And when the vessels are overstretched, the capillary, how do you call it? The membranes will open up. So this plasma here will start seeping through the small into what? This is the cell. This is the interstitial. And this is the intravascular. So fluid has shifted from the intravascular to what? Interstitials in between the cells. That fluid that is shifting from here, it is not going to inside the cell. If it comes here, we will do cross. You say, thank you, God. Okay. The person will not have what? Edema. But when the water is caught up here, interstitial, interstitial, you've heard it before, you're a nurse. Okay. The person will start having what? Edema. And all this edema, that means fluid has shifted to this space. Okay. So you will see all other stuffs will come in later and create problems for us. Okay. Yes. You will be having all these heart murmurs, fluid is not going, the heart is pumping, so all these holosystolics murmurs. Okay. The heart, let's do an x-ray of the chest. You will see that there is a wide or a big heart. Okay. Cardiomegaly can cause that. Yes. So all these issues are there. Let's go to the left side. The left is supposed to pump blood through the aorta. But for some reason, this one is collapsing. So blood is here, blood is here, blood is here, blood is here. Okay, if you are not allowed to move blood onwards, it will move backwards. That is about heart failure. If the chamber is not able to move, push the blood forward, the blood will move worse because of the pulling. Okay, a pile up. So this is my aorta. The aorta is not getting blood enough because of a failed ventricle. So the backwards flow will go, a pulling. Okay, so flooding, 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 flooding. Where is the next destination? Inside the lungs or the chest. This one has tiny, 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 tiny capillaries. Okay. And because of the pooling, it will create what? Pressure, high blood pressure, high blood pressure. So we say what? The pulmonary vein pressure will shoot up. Remember, this is the artery. The artery is connected to what? The right ventricle. But in right ventricular failure, if this chamber fails, it cannot push enough blood through the pulmonary artery. So when I check the blood pressure in the pulmonary artery, it is low because it doesn't have enough blood or more blood inside the arteries of the pulmonary system. Okay. Any vessel that takes blood away from the heart is called an artery. And any vessel that will bring blood to the heart is called a vein. Take note. So back to our left ventricle, it has failed. It cannot move blood through the aorta. So we are getting a backwards flow. So let me go and check the blood pressure in the pulmonary veins. It will go up. That is one. The tiny capillaries, this pulmonary vein, the tiny capillaries that joins it with the pulmonary artery here. it will start bursting, it will overstretch, the walls will overstretch, their capillaries will give up. So plasma here will start seeping like the way we got the pedal edema here. The same thing, plasma will start leaving the bloodstream to what? To the chest or to the pulmonary chamber. That will cause cooling, flooding inside what? The child's oxygen is coming, it cannot go, carbon dioxide cannot go until you drain this water from here, or you change the patient's position from supine position towards semi-fireless or high fireless. That is it. Okay. So pulmonary venous hypertension and what? Pulmonary edema is a problem. The left ventricle has a lot of responsibilities than what? The right ventricle. So because the left ventricle is in trouble, okay, now it cannot pump enough blood to the aorta. And the aorta is waiting for blood. Where is my 2,000 mils? It must go to every body part, including the heart itself, including what? The vessels, the lungs. Remember, the lungs, I think the other batch, I was telling them that this is the lungs and this is the heart. That vessels that leaves the heart. The vessels that leave the heart, the arteries, okay, the aorta and whatever. We've got branches that supply what? This one pass behind the heart and supply the lungs. Okay, the lung that blood supply from the pulmonary system. We have what? Uh, the intervertebral or the vertebra. Yes. So when so can you hear me?
Yes, we can hear you now, but you went off. Okay.
Yeah, I don't know. Okay. Right. So let's continue. Where did we get to? Okay. So where's my pen? So sorry for the break. So this is the aorta. It is not getting what? Enough blood. What will happen? The blood pressure inside the arteries will drop. It will drop. That's where the problem starts from. Blood pressure is dropping. Blood pressure inside the arteries because we don't have enough volume. Meanwhile, too, the ejection fraction is very low. Okay. So you can't give plenty IV fluid. Blood pressure too is crashing. What do you do? In this case, what do you do? Betty, what will you do? The ventricles of the patient doesn't have strength to pump blood into the system. Okay. the body organs are failing because the aorta or these arteries, they are not sending enough blood to the body organs. How will you know that? Okay, patient is from the head to the toe. So CNS, loss of consciousness, lethargy, okay, altered mental status, all these ones. That should tell you that no, the central nervous system is crashing. Okay, let's go to the heart rate. The heart rate is trying to compensate. So it will give you reflex tachycardia. So yes, it will shoot up. Okay, but with time, it will give you arrhythmias and give you asystole if you don't do anything about it. Okay, the blood pressure will be dropping. That should tell you that we are not getting enough blood inside the heart arteries. Take note. There is a difference between blood pressure and what? And saturation. So take note. Okay. So the pressure
Please,
inside the blood vessels are dropping. Okay. Saturation too is swinging up and down. Okay. Now, what do you do? Betty, in this case, what do you do?
um, hmm. Would you do the cardio version?
Betty is saying she will do cardioversion, Jesus Christ. Betty
In
want to kill. Do you
fact,
know when we do cardio?
I'm just lost, so I'm just saying
Yes. Anyone to
I or would position because I'm thinking positioning. How will the positioning to help? And it wouldn't be the answer. So at this moment, I'm lost. I mean, someone help.
okay. So Faustina, are you there? I'm seeing Faustina and Jamfi. So tell me, what will you do? My ventricles are collapsing.
Senior Pacho, Ceciana may join you. Ceciana may bosso. Yeah.
Okay. The next time you speak English for us, okay?
All right, sure, no problem.
Then, yes. Then, where are the guys? Nico, are you here? Nicolas, are you here to? Okay, Nico might not. Dave, what will you
Yes.
do?
Can we help with the drugs then? If we monitor the heart rate and it is more than 60 beats per minute. But I was wondering if in children, and that's why I'm a bit confused.
Yes, you can give low dose, small dose, just to supplement kind of. That is why after you give, you monitor for apical pulse in pediatrics,
Okay, so
children.
please,
Okay, that is one thing. What else will you do?
but please, can I ask the question before your
Okay.
question? So in as much as we give the digoxin in the adult case, and we then want to, before we administer the drugs, they want to make sure the heart rate is more than 60 beats per minute. Is it there's the same case apply in children?
Yes, if you don't have any issues with your heart rate in this scenario in adult, you don't have to give the toxin. You understand?
Right. Please, like with what Betty is saying, like I think I understand Betty. Like if with the adults is if it's below 60, the epical pulse is below 60, we are not supposed to give the digoxin. What about the case pulse epical pulse rate? Like what should be the
So children mostly survive with heart rate. They don't mostly go with the blood pressure. That is why children, we are more focused with the digoxin, okay, to help the heart to pump and the blood will come out. But if you are doing with adults who work, who survive more with blood pressure, okay, digoxin will not be your priority medication for adults. You understand? Because I have told you on this platform that a child's heart rate will be high, and as you age, it's coming down. Then the blood pressure is going up, like that inverse proportion. Okay, yeah. So children survive with heart rates more than blood pressure. That is why when a patient comes to the hospital, a child 3 years old, what do you check? You check their pulse or heart rate, and maybe their saturation. Do you worry yourself to check the blood pressure of this child? Not always. Okay. Yeah, I mean, their heart rate and this digoxin will help the heart to pump them, to give the heart muscles energy to pump. Okay. Yeah. So that is it. And they will tell you that monitor apical pulse, not pulse on the hands and all those stuffs. Okay. So that is where please, have I answered you?
Yes, sir. Thank you so much. So
Good.
apical.
Yes.
Okay.
So that is what we are doing. Still, my question is on board. Who has answers for it?
Yeah, please, I
Assuming
couldn't hear
this
your
was an
question well.
adult, assuming this was an adult, ventricles are failing. Okay. Blood pressure is crashing. Blood is not moving to the brain, so the central nervous system is crashing. Okay, CNS is crashing with lethargy and all those stuff. Major organs, the kidneys are shutting down with low urine output. You fast catheter, but catheter empty for hours. Okay, what will you do? Ejection fraction is, let's say, 25%.
That means there's a likelihood of a clotting issue, right? So if there's any anticoagulant I will administer, then I will be thinking of oxygen, so that will supply to the various tissues in order for them to get the oxygen needed. I don't
Why do
know.
you think it's clotting?
That's what I don't know, because I joined when we were teaching. I wasn't there. I only joined, but I was doing something.
You didn't join early.
Like,
Okay, so we are dealing with
yeah.
heart failure as a condition now. We started with the kids. Now we are doing with adults. Like I gave a scenario because some people will be writing very soon. That's why I want to cut both sides of the yes, of the coin.
Please, it's Michael. I want to try the question.
Okay, try.
So in this case, there is the heart muscles are weak and unable to supply perfuse the vital organs. So you want to maybe give an inotrope to, first of all, you position the patient to in a way to shift blood supply to the important, very important vital organs like the brain and the heart itself and the lung. So after positioning, you give an inotrope, something like dobutamine. Dobutamine can be given to strengthen the heart contractility in order to push blood to especially the vital organs. Please, that's my opinion. Thank you.
How about the blood pressure?
The blood pressure.
What will you do to bring it up?
To bring the blood pressure up. You want to give what you call fluid, IV fluids. Maybe a calculated.
Patient weighs 70
You
kg.
calculate it based on the child's weight, and then you give. You wouldn't want to also burden the heart too much. So.
Okay. Right. So if it's an adult,
hello, sir.
You give your process.
If I want to assist in answering this question, I might take us back. But you let me allow, then I'll follow it as is. Because maybe this thing is just some common sense.
Okay.
But
yes,
but
Mr.
I
D.
didn't follow it from the beginning, so
Yeah.
I'll allow you to flow so that I'll follow and then learn. Thank you.
So, thank you. Let's continue quick. So, I mean, some of the signs you see: tachycardia, tachypnea, poor feeding. We are dealing with pediatrics. Okay, heart failure. They are in serious distress. Diaphoresis, hepatomegaly, and edema. Okay, yeah. So you see all these ones. Okay, these are added notes for the Kawasaki. Please, if you get a slide, catch it. Okay, added notes for the Kawasaki. So, like I said the other time, I've updated the notes. Okay. Now, let's look at the nursing management. So your oxygen, okay, your diuresis, very important. Okay, digoxin, small and frequent feeds. This is not the time to force dumping all these solid foods inside them for the child to eat more frequent foods. Okay. Now, so let's go to the neurological disorders. We took the cardiovascular. We have looked at the heart. Children don't have issues with blood pressure a lot, so hypertension, we are not going to treat it in pediatrics. You understand? Yes. If you see hypertension in pediatrics, it means a problem is caused. You should consider it as a sign and symptom, not a diagnosis. So take note of that. Right. So we've done the congenital heart diseases. I've explained everything to you. We've done they sometimes get generalized vasculitis. We call it what? Kawasaki. Kawasaki. The skin will show so many red spots. Their tongue, red spot, mucosa in their mouth, very red, or how do we call it? Strawberry. Okay. Yes. And all those other signs which I've added here. Swelling, joint pains. Yes. In the joint, there are blood vessels, arteries. It will cause issues there. I mean, heart, the signs of heart inflammation. So, murmurs, cardiomegaly, pericarditis, then the painless nodule overgrowing prominences, especially the subcutaneous. And we have the erythemas, then pink ring-shaped rash. It is non-pruritic. Yes, this is just an inflammation. Okay, so you should know it's not an allergic reaction. So take note of that. Then we have the Sydenham chorea. We are looking at the involuntary checking movement, emotional abilities, and poor coordinations with it. So all these ones fall under what? Kawasaki. Okay. Then we have also looked at heart failure in children. It's very common. So you know your congestive heart failure and the cardiomyopathies. We've done the signs and symptoms, and we've done what? The nursing management. Perfect. Now let's move towards the nervous system of children. the nervous system. So when it comes to pediatric, I do it system by system. So those of you who have joined my class, I always do it system by system, and we move on. So in pediatrics, nervous system, some of the disorders, you will see what seizure, very common, seizure disorders. Seizure. So seizure, some of the causes are what? Fever, infection, epilepsy, and head injuries. These are the major causes of seizure. So when a child gets seizures, and sometimes electrolyte imbalance, so you should take note of that. Okay. How will it present? The altered loss of consciousness, tonic-clonic movement, or the post-ticker phase. The post-ticker phase management. That one too, you know. Then we look at what? The nursing priority. For those of you who are going to write licensing exams, airway management. Very important. Remember, when we started pediatrics, the anatomy, their airway is small. Like this. Very small. So once seizure sets in, the airway is mostly closed. So what position are you putting them to maintain proper airway? Yes, you turn them to the left side, okay, with their health. So the recovery position is very important. You turn them, to their side, sometimes head tilted to the left side, the chin is lifted, and all those ones to open the airway. Never restrain any human being, okay, undergoing seizure. You break their bones, you tear muscles, and cause issues. And seizure monitoring is very important. So the time is started, the duration, and the time is stopped. And if another seizure will come back, the reason why we monitor when the seizure stopped, because you, the nurse, if you are able to tell us that the time is 2:03 p.m., that is when seizure stopped. The next time seizure starts, you will also document the seizure start again here. So we will compare that how long was the refractory period. Okay, we call here the refractory period. A period of rest, a period of, yes. So we have refractory period in so many circumstances in life. Okay, refractory, in between activities, there's a short rest. They call it the refractory period. Okay, yeah. So men, if a man enjoys his woman and he ejaculates within from the time of ejaculation to the next activity, there is a rest. We call it refractory. If there is a seizure, the end of seizure to the start of another seizure is what? If, let's go to mental health, a person has psychosis, okay, exhibiting hallucinations and all those stuffs. So we have the active phase. So in the active phase, patient is psychotic, whether they are very aggressive or not, they are exhibiting psychotic symptoms. So when you see a madman walking on the street, yes, don't only look at their dressing, but look at the physiology, the span of the psychotic manifestations, okay? So in this active phase, they will be showing all these hallucinations and all those psychotic symptoms. But remember, there is a time in that cycle, it's a cycle, that these hallucinations will come to a stop. and it will give them a short period or a period of lucidity. We call it the lucidity. Okay. The lucid period. Yes. So it makes their mind, they think well. Okay. But the thing is, within a short time, they go back to the psychotic phase again. Yeah. So these are the things you should know. Okay. So let's look under this. Let's go to febrile seizure. I have seen seizure caused by what? Fever, febrile. Mostly children 6 months to 5 years. That is where you find this problem more. It is triggered by rapid, a sharp rise in temperature. Okay. Infection has gotten into the bloodstream. So this is an infection. Okay. These blood vessels are connected to what? The heart. So these two, the heart and the vessels, fall under the cardiovascular system. Okay. That blood that the heart has pumped into the blood vessel, the blood has what? Temperature. And it helps us to feel warm or cold. Okay. It helps us to feel warm or cold. How does it help us? It has a regulator in the brain called the medulla oblongata. How do we call it? Hypothalamus. Okay, hypothalamus. So when the blood is out of the heart, okay, it gets into the blood vessels. The blood vessel will communicate to the skin. But there are so many metabolic activities going on in the body. Even the hair, not your artificial hair. There is metabolism going on, and the end product of metabolism is heat production. So when there is too much heat, okay, in the system, there's going to be a communication with the skin. The skin will now scan the atmospheric what? Temperature. That, oh, I am in my room. Now you are in your room, you are watching me. That room you are, there is an air blowing around your skin. What is the temperature of that air? Is it hot? If it is hot, okay, the skin will sense it and will send information to the hypothalamus. And the hypothalamus will tell the blood vessels that dilate. When they dilate, you see all these tiny, tiny, tiny capillaries that are connected to the skin. They will be releasing sweat. Okay. Especially when you are in that intense pressure. Sometimes the sweat will just be coming like clot of blood. Yes. So if I want to hijack, if an infection gets here, if an infection gets here, they will cause, they disrupt all this physiology. Okay, they disrupt it. Vaporize. You and me, we are adults. Okay, our body can compensate. We have a powerful compensatory mechanisms to what? Yes, I have infection, temperature is high, but I can still compensate and not get seizure. But the little boy or girl does not have that strong ability. They have it too, but they don't have strong ability to terminate that sudden change of temperature. So what now happens? The brain will be what? Firing a lot of neuronal activities. They fire. They fire like this. Okay. And it will give them what? Seizure. You seeing the brain firing a lot of what? Nerves to go and solve the problem. It's a compensatory mechanism of firing a lot of nerves to to control the system. Okay. What are you supposed to do? Are you supposed to put water on the head of the baby of this child? No. It is a sharp see. This sharp rise, it was, let's say, temperature was 0. All of a sudden, temperature has risen to 40. Mhm. Then you also go and what? Push it down. Okay. You did not allow the temperature to slowly come down. Okay. Your concentration was on the head of the baby. Put a lot of water there. You cause issues. So why don't you start from down below, legs? Then you tap a sponge upwards. Okay.
Hello, sir.
Upwards. Yes, sir. Dave.
Hello, sir. Does that mean the process of tipping sponging, the one we learn in school, is not the right way?
Yeah.
Let's forgo English for now, but let's concentrate on what they taught us in school.
Per physiology. Okay. Hair physiology. And also, your aim is to bring the temperature down. So, one, the water you are going to use, what is the temperature of that water? Is it pure cold water or just a running water tap?
Just a running water, the one from the tap.
Yes. Why is it that it should be lukewarm? Lukewarm because the body has cells, and the cells and the metabolism is superly perfect when they run between a temperature of 37.2 to 36.2 to 37.2. Okay. If temperature drops below 35, this cellular metabolism will slow. It will come down. Have you seen these girls who have been using steroid? Anytime they get infections, go and look at their body temperature. It goes slow. That is why we put in a catheter. And at that stage, we are not going to do thermometer in your armpit. Okay. We put in catheter and we monitor temperature from your bladder. In that septic stage. Yes. Why? Because low temperature reduces cellular metabolism and metabolic activities. Okay. So your body slows down. Already there are infections in your blood, already battling you, causing fluid to move out, crashing your blood pressure. Yes, the heart will try to compensate by increasing heart rate. Okay. But before you see heart rate shooting up, already blood pressure is on the way, crashing. So this child who all this physiology is going on within him or doesn't have the strength to overcome. You are not going to put water on the head. Okay. You are just damping the central nervous system. That is where in the central nervous system, that's where all the regulatory cells are. The regulatory cells are. So that is it, guys. So take note. But febrile seizure, the good thing about it is that it's not malignant. It is benign and self-limiting. So when your child gets febrile seizures or whatever, don't say, my child has epilepsy, my child has this. No. Okay. No, don't say that. It will go. Just control the temperature. Relax the muscles. Okay.
Sometimes they will
Because
say,
in
sometimes they will say, Surakano.
yes. So why do we have to relax the muscles? A child is having high temperature.
Mm-hmm.
The brain, the hypothalamus cannot control it again. Okay. So the muscles will go into spasms with the aim that okay, let's now release some sweat out of the body. So child will be sweating. How do we release sweating? Before you can sweat, the muscles, the muscles must contract. So the muscles contract, dispense out, release more heat, then the skin will exit it out as sweat. Okay. The brain is trying to solve the problem by shooting a lot of nerves to the muscles and all these muscles, the muscles of the blood vessels to apart. Okay. What do? I'll give an antipyretic. This one. And where is this coming from? All this reduce the temperature. Okay. Yes, they reduce them. And how about the muscles that are contracting? It has to be relaxed. Okay. Do I have to give muscle blockade to this little boy? No. Do I have to give atracurium to block these muscles or rocuronium or sax? No. If you do that, you collapse the respiratory muscles and the baby cannot breathe. And you have to go and intubate the patient. That was two troubles, one God. So we have a certain medication that can equally relax the muscles a bit, okay, and also take away anxiety, okay. So we have all these benzodiazepines. In Ghana we use Valium and like all these diazepam, rectal suppositories, okay,
And
to bring it
Phenobarb.
down. Some people will some people will use Phenobarb before you use Phenobarb or Pheneton and all those stuffs. That is when superly is kind of becoming refractory. Then you increase the seizure threshold. Okay, so these ones will relax the muscles, would IV and uh, and rectal. Okay, hydrocephalus is another problem for kids. Okay, in the central nervous system. So hydrocephalus,
Yes, sir.
cephal. When we say cephal, David, what is the meaning? And cephal, let me add this one to it.
Hello, sir.
Yes, who knows? And cephal.
No, I know it has to do with the it has to do with the head. Yeah, it has to do with the head. But I want to ask a question. Hydrocephalus. I want to ask a question. I want to ask a question. I want to find out the
Yes, Axel.
now we understand that children, when their temperature is too high, we are not supposed to go straight forward and be doing step sponging and then placing water on their heads, like in a way forcing to bring the temperature down, which is not acceptable way of doing it. So I want to find out the best practice of doing it because I didn't get it clear before we come to the
Tap a
hydrocephalus.
sponge from below to the head. So if this is your body and this is your head, why don't I focus on reducing the temperature from here upwards? So by the majority of the body, temperature has been controlled and reduced a bit. You understand? That is it. Then you get to the head, everything comes down for you. Rather than starting
Is it
from
only
the head,
applicable to children or both adults?
both adult and children.
Please.
Okay. Both adult and children.
Thank you, sir.
Both adults and children. I will say that. Okay. Now, are you okay?
Right.
If you are, yes, ma'am.
Please, good evening. From my side, with the use of the phenytoin, with the diazepam, I understood that it can be given rectally and then intravenously to reduce the muscle spasms in the seizures.
Okay.
But with the phenytoin, I didn't really get the explanation well. Can you please hammer it? Thank you.
So the phenytoin and all those ones, okay, you give it to increase the seizure threshold. Okay. The seizure, everybody has a threshold. You have your threshold, I have my threshold.
Okay.
So let's say this is the 0 level, this is the 100 level, and this is the 50 level. The nerves in your brain, if you have whatever the cause is coming from, whether electrolyte imbalance, whatever it is, or accident and all those stuff, they spike, they shoot. Okay. It's a nerve communication. They shoot. So when they shoot and your threshold is at the 50 level, when the nerves trigger this point, you get seizure.
Okay.
You understand?
Yes.
Yes, you get seizure. But all these medications, we give it to increase the threshold from here to here.
Okay.
Especially people with what? They get reoccurring seizures. Reoccurring seizures. There are some people, their body cells, there is a problem with some parts. Okay. So, all these epileptics, all those stuff, we have to constantly increase their threshold, bring it to this level 100. So, yes, you are not stopping the nerves completely from shooting, but you are giving the nerves more work that if you want to trigger seizure, then you have to spike from here to here. By the time this nerve gets to maybe 70, they are already tired. They can't trigger it. But you know the negative side about some of these medications. Once you stop taking it, the threshold will be coming back to the 50. So go to care home. Today, somebody has maybe all these pregabalins, gabapentins, all these seizure medications, sodium valproate, and all those. Go and don't give them for a week. Sometimes less than a week. Today, you are supposed to serve this medication. You did not give. Tomorrow, you did not give. Tomorrow, next, you don't give. It will shock you that they will start seizuring. Some of them will start seizuring. It means the threshold has decreased. So these nerves don't suffer to trigger seizures. Please, do you understand? Haj. That is why some of these medications, if you don't give it to the patients and they catch you, you are in trouble. Okay.
Thank you so much, sir.
They can worry you. Okay. So hydrocephalus is talking about what? The encephal is the brain cell. The brain cell is called parenchyma. Okay. So brain cell. This is my brain cell. When I go inside my brain, these are the cells. Inside the cell, we have blood vessels that supply the cells. Okay. And all those stuffs. And these are the tissues. And inside the cell too, we have we call it vectors. Okay. They contain what? Or they produce the cerebrospinal fluid, CSF. So I have blood, I have the brain cell, and I have the CSF. Okay. Yes. Something can happen to the CSF, this channel, and it will be leaking into the brain. When it leaks into the brain, it will make my brain big, swell. Something can happen to what? The blood vessels, the fluid inside, or the blood will be leaking into the brain, or to swell the baby's or the child's brain. Something can happen to the tissues. Can somebody knock this child? This child was not wearing seat belts, trauma. Anything can happen, even infection of the cells itself can cause that. When that happens, you see what? Fluid accumulating. Fluid will shift from one chamber to a free space. That's it. Every fluid in our body has a container. So they move to a free space and cause issues. How will you see it? You will see, and when that happens, the intracranial, there's a pressure. The fluid will come with pressure. Volume is equal to pressure to go up. So you will see the bulging fontanelle, very important, especially the anterior fontanelle, bulging up. Rapid head growth. That's why when a child is born, the doctors and the nurses will be advising that this child should have what? Little hair, so that we can measure the head circumference with a tape measure. That your child, do you know the head circumference? The mothers on the page, do you know? You don't know. Okay. So you should be measuring your head circumference. Okay. Yes. Then sunken eyes. Okay. Sunken eyes. You should also take note of that. So how do I drain this fluid? How do I drain this fluid out? Do I go and, okay, blood vessel, fluid is leaking, or CSF from the ventricles, they are leaking, okay, into the, or they are overproducing, they are more, especially the CSF is plenty. It makes the head has become so heavy. Okay, we need to drain it out. How do we drain? We now take what? A tap, like a certain tube. Okay, then we go to the brain, place the tube inside these ventricles here. Google it, you see it, ventricles. What is the work of the ventricles in the brain? Their duty is to what? Produce cerebrospinal fluid and also contain it. Okay, that is it, ventricles. So if I have these ventricles with CSF inside, and the CSF fluid either is leaking or it has become plenty, overproduction. What do? I'll go and create a tap here. And put a tube here and bring it to what? My abdomen. Why abdomen and not your pelvis? Because the abdominal cavity is very big. Sometimes they even, yes, they put it in your abdomen. So they will be draining this fluid little by little. Give it time. Patient will come to the ward. This one will be draining bit by bit. So what we call it, and they will pass it. You can't channel something from the brain to the abdomen without passing through the peritoneal cavity. Okay, so we call it what? The ventricle peritoneal shunting. Shunting. Okay. If it is cardiovascular system, you will not see the English shunt. You will see what? A bypass. So you hear diagnosis, coronary artery bypass, CAB, and grafting. You see, it's the same procedure, but like I told you, a river flowing from the north to the south. Every town that river gets to will get a different name. Yes. So a bypass in cardiovascular system and a shunting in what? Yes. In when it comes to this gastroenterology, they will say what? Incision, how do we call it? Anastomosis. They cut anastomosis, then maybe they drain it out. All these drainage tube and all those stuffs. Yeah. So you, the nurse, your duty is to measure the head circumference. If you suspect any hydrocephalus, then you monitor for shunt infection or more functioning. Yes, patient is back to the ward. There is a shunt. I'm expecting the head circumference to go down because I'm now draining this fluid into the abdominal cavity. Okay. Before they went to theater and I measured their head with the tape measure, I got what? What is your waist size? I got, let's say, 10 centimeters of their back, like 2 days or one day. Now, I measured the head again. It is 15 centimeters. Are you not the one who went for surgery? Okay, so this shunting we went to do, is it working properly? Or what? So we begin to question more functioning of the shunt. Okay. Shunt is infected. We know the signs of infections. Temperature monitoring. Okay. But remember, infection, temperature, heart rate, babies, and respiratory rate. These guys will shoot up. When they shoot up, sepsis protocol should be triggered. Don't go and look at only temperature and come and sit down without knowing their heart rate and their respiration rate before you even take your blood works. Okay. Let's go to the next one. Spinal bifida. Spinal bifida. Okay. Yes. So this I've been explaining. Okay. Everybody knows that this is your head, this is your brain, and this is your spinal cord. Okay. This spinal cord has a certain cloth that covers it, and the brain covers it like a cushion inside. We call it what? The meninges. I'll say meninges. This is the spinal cord SC. Yes. And we have our structures, the muscles and everything. Then last, we have what? The vertebral bones. Okay. The bones. Like this. Okay. Yes. That surrounds it like this. So this is the human being. You see how God created us? This spinal cord, it does not come all the way to your anus. It doesn't work like that. It stops on the way. But these bones will still continue downwards to your coccyx. When you go and sit on the toilet and you are pooping, and the coccyx, the last bone. Yes. Why did God add more bones, knowing very well that the spinal cord will end here? Okay. That is another topic for them. So this fluid will come in. We have a pool when you come to the bottom here. We have a pool of cerebrospinal fluid. And this side, the cord, the tail or the cord, we call it the cauda equina. Okay, that is there. Right. Sometimes a child will be born, or as the child is developing, you realize that this bones you realize that a certain child was born, this hole is gone. What happened that this hole has been created here? We'll push the structures here. It will herniate it out.
Please, you are muted. We can't hear you. So please, you are muted. Muted.
Okay, thank you.
Yeah, I think it's
So yeah, I can hear you. Let's continue. We have 30 minutes to go. So if these bones, a hole is created here, you realize that what? This is the spinal cord, these are the meninges. Okay. Sometimes there is a hole here, but the pressure inside and surrounding, like the pressure is surrounding the spinal cord, in between the spinal cord and the meninges. That pressure will not be so high. But if it is high, like a hernia, if the abdominal pressure is high, it will push the intestines through the hole. So if the pressure surrounding the spinal cord is super high, it will push the structures, the meninges out. And where this is the hole, so the meninges will pass it. Now, if the pressure is okay, that doesn't mean that this bone is going to fail. The hole will still be there. So in this case, you have a diagnosis of spinal bifida. Because the pressure around your spinal cord is low and that there is no herniation, we will say that what you have an occult spinal bifida or spinal bifida occulta. Take note. A hidden occult is, I don't know which country language is that, but the meaning of occult means hidden. So occultic, people will say we are occult. In the night when people are sleeping, that's where they will wake up and go and meet. So there is a hidden problem here. Okay. Now, when the pressure starts coming up, or sometimes body positionings and body mechanics and all those stuffs, okay, the meninges, these meninges will herniate out like this. So the meninges is out, but the spinal cord will be inside, dangling, moving, ping, 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 ping. Okay, nothing has happened to the patient. It is only the meninges that has herniated out. So yes, you do all your scans, your X-ray, MRI, whatever, you will see only the meninges out. So when that happens, we will see what? The cells, only the cells of the meninges was able to herniate. So we call it what? Meningocell. Okay. Meningocell. If you know the anatomical structures of this, you are done with spinal bifida. You will not learn it again. I remember anything the brain interprets, they give it to the spinal cord. And the spinal cord will give it to the peripheral nerves. So we have the central nerves and the peripheral nerves. These peripheral nerves and the central nerves, they are not connected to the meninges. They are connected to what? The spinal cord. So we have a nerve that supplies the bladder. If the kidneys bring urine to the bladder, this nerve will be what? Stimulated. And what? They will contract the muscles of the bladder. Then you can urinate. Otherwise, urine will be here and they will turn into crystals. We have a nerve here that supplies what? The blood vessels. So when the blood vessels temperature or whatever, blood pressure goes high, they will relax the muscles and it goes down. When blood pressure drops, they relax, go. In medicine, we call it homeostasis. So if you want to know the function of this nerve that supplies the blood vessels, have you sat in a car before? Everybody will say yes. When the car is driving and you see a mountain, so at first it was like this. This is the road. Then the car will suddenly climb a mountain, sharp mountain, a very sharp and short mountain. They will climb like this. Once they climb, then the car suddenly descend from this place till you get here. Your blood pressure will suddenly drop. Zzz. Then you feel in your stomach. Zzz. Okay. So this nerve is that blood pressure that drop from here to here. This nerve is recovering it back to normal. We call it homeostasis. Yes, that should tell you that your this nerve is a powerful tool. It's helping you. It's a guide. Okay. Now, only the meninges herniated, so meningeal cell. Let's go to the next one. Sometimes you find babies that or children that the meninges came out and the spinal cord also came out like this. Okay, so we have what? The myelomeningeal cell. Myelomeningeal cell. So myelomeningeal cell is the most severe form of spinal bifida. The most MRI will show you. So don't worry. Okay. Myelomeningeal cell. This child, okay. Now, we have a nerve here that controls respiration. Okay, it controls the lungs. We have a nerve here that controls the diaphragm. Okay, I have a nerve here that controls the stomach. The cervical spine nerves. Which one does it control? Okay, but I have a problem at this level. And you realize that all the nerves that will flow below this trauma or issue level, if this nerve controls what? Your large intestine, it means it's going to collapse henceforth. What will now communicate to them? We have motor cells, and the motor cells are going to the muscles. Okay, so if I have got a problem here, if I have got a problem at this level, I've got a problem. Now the motor nerve here is damaged. So my intestine is full. Okay. The sensory nerves have sent the message to what? To the brain. The brain has interpreted it. Now it is the duty of the motor nerve to bring what? The function, the activity. I am talking to you. Sensory nerves are going, the motor nerves are coming to my lips to help my lips, my tongue, my voice box, larynx, to what? To speak so that you can hear. Let me get an injury. Use wood to come and hit the back of my neck here. That is it. I can't talk again. My motor nerves damaged. Okay. So, yes, your intestine is full with poo-poo. But the motor nerves that will communicate to the muscles here to contract and make sure that this poo-poo will come out has been hijacked in this hole as a hernia. Myelomeningeal cell. How do I poo-poo? When these feces stay in your intestine for long, all the blood vessels here will drain all the water out of it. And it will be very dry and you get fecal impaction. The muscles here, because they are not working, they are not contracting, they will be flaccid, they begin to die. And they what become necrosis, ischemia. It starts with ischemia, then you go to necrosis. And when it gets to necrosis, necrosis is the dead tissue. Okay. When it gets to necrosis, there is nothing I can do about it. When it is ischemic, I can let blood supply flow to the muscles and the muscles will recover. But when it is necrosed, you have to cut this place and cut this place, throw it away, connect this side to this side, anastomose. Okay, because of this crazy thing here. Yes. So otherwise, if I don't do anything about it, and these muscles, after they have rotten, necrosed, they will begin to waste at the tip. If you pour an acid, okay, on a tissue, you see how it tears. Okay, the same thing now, it will become weak and it will tear. When it tears, it means this hole, there will be holes here. So all these feces will now pass through these holes and drop into what? The abdominal cavity. The abdominal cavity is lined with what? A peritoneum. So this poo-poo will not enter your pelvis. It will not enter into your scrotum, but it is going to drop on what? The peritoneum. The peritoneum will start becoming infected because this one is carrying infection to the peritoneum. So the peritoneum will become infected and you get a peritonitis.
Hello, sir.
Yes.
Hello, sir.
So, yes.
I'm sorry for taking my call. I'm getting confused over here. I mean, where there's going to be necrosis for, and then the muscle there getting torn. I mean, I'm a bit confused. I'm lost more.
Where's your, do you want the physiology?
Yeah. So the particular site I'm not totally lost, but the particular part of the body where it's going to get torn, get necrosed, and then lose its function here. That's where I got missing. Yeah.
So, we have depending on where the problem is and the nerves that supplies it. Remember, the nerves that supplies here, they don't supply only to the intestine or whatever. They also
Mm-hmm.
supply to the blood vessels here. And the
Okay.
blood vessels here, where are they going? They are going to the muscles. Every blood vessel has a muscle attached to it.
Okay. So, sir, it's not.
Okay.
It's sir. Sorry. It's meaning it's not
Your network, I don't know. I can't hear you.
where the what do you call it? Where the bifida, okay, but rather where the nerve supply. Right.
Yes.
Hello.
Okay. You are having a bifida here.
Mm-hmm.
Okay. You're having a bifida here where your meninges and your spinal cord has herniated like this.
Yeah.
Okay. There is a blockade because of the ischemia and all those stuff here.
Okay.
So these motor nerves that are supposed to go here, they will
Okay.
be relaxed. They can't work.
Okay.
The blood vessels, tiny, tiny, tiny blood vessels that are waiting for these motor nerves to come and trigger their muscles to contract and supply blood to the intestine. Two will be blocked because of the problem here.
Okay.
It's a connection. You understand?
Yes, sir.
It's a connection. Okay. In the house, this is electricity company. Okay. They will build their pole. Ping, electric wire, another electric pole, another electric pole, another electric. If I come and cut this electric wire, every structure that follows this connection, light will go off. Do you
Yeah.
understand?
Thank you.
Why? Because, yes, But every structure that was here before this problem will still be working. You understand? So the thing is about connections. Okay. This is the intestine. I'm coming. Let me show you. I think we need a picture. Okay,
It's just
so that
about
you
the way of
understand
getting
it
job
well.
in Ghana. It's about way of getting job in Ghana.
Yes, yes, you need.
You don't know anybody who
Connection.
got job.
Okay. Yeah. So enteric blood supply anatomy. Okay. Yes. This is the intestines. Like the way you get a job in Ghana. Jesus Christ. Okay. So view image. I think I still remember. Yeah. So you see the way these blood supplies are supplying the whole intestine, this large intestine. Eh? This blood supply too, we have the spinal cord at the middle like this. And there are what? Nerves that will leave the spinal cord and come and connect to this blood here, blood vessel here, and help the muscles of the blood vessels to contract. But where's the case? I have a problem here. I have a spinal bifida here. And because of that, this nerve that is supposed to live here has been damaged by this hernia here, the bifida here. So this nerve does not have the energy or the strength again to supply this blood vessel. And this blood vessel, because the muscles are not getting nerve supply, they will also become flaccid and weak. And they can also not contract the blood vessel to push blood toward the intestine. So who suffers? The intestine suffer in the end. So that is how it is. Okay. Yes.
Yeah.
So every blood vessel you see. Okay. Let's do the same thing to the let's do the same thing to the bladder. Okay, this is the bladder. The bladder is sitting here down below. Okay. This is the spinal cord. This bladder has muscles. So these are the muscles. If the muscles don't contract, the bladder will never empty. Okay. So these muscles also have what? Blood vessels connected to it. That will give it energy, oxygen, for it to get the energy to work. So this is the blood vessels connected to the muscles. Okay. This blood vessel also has tiny muscles around it, like this. That will also have to contract to push the blood to the muscles. Okay. Where are these muscles getting their energy from? They are getting their energy from the peripheral nervous system. So if I cut this connection, everything here cannot work. So we have a child who has spinal bifida, the big one. Okay. Yes. So you have a hernia here connecting to this. This hernia has destroyed these vessels here, these nerves here. What do you think will happen to this guy? This guy will suffer. This muscle will suffer. The blood vessel will be weak. they cannot push blood to the muscles of the bladder. The muscles of the bladder will be weak. Urine is here. They can't contract to bring the urine out. So what do? I have to pass catheter. If you can't help me, let me pass catheter and empty my bladder like that, like that. Okay. So you see the connection. It's a connection. That is why when we are doing anatomy and physiology, we do it together. In every school you go, you learn anatomy. You should learn physiology to understand what is going. Because if you don't understand, you will never know that there is a relationship between this and that. So yes, the same spinal cord is connected to, let's say, your muscles of the leg. Okay. And because of the problem here, all the nerves down below here will be in trouble. So somebody will be paralyzed. Somebody will have bladder and bowel dysfunction. Okay. Because of this sac-like protrusion on MRI. Okay. So your duty is to protect this sac. Let me show you this picture. It's a nurse. Protect it. Infection. You are seeing somebody's spinal cord outside the skin. Not even inside the skin, but protruded out. Spinal bifida. If you infect the nerves, you went in to help, but you are caused trouble. So see children like this. Okay. After this, then we close. So let me enlarge it. Everybody can see. Yes. So you see, this bone here is lost. Before, there was a bone here. But some children will be born. This bone is missing. You understand the physiology now? When your child is born, do you pass your hands behind the back like this to palpate the bones? Okay, because this thing, a baby who is born today, you will never see it, because until there is pressure here, these structures will never herniate. So how do you know that my child is having a missing vertebra? You understand? So this one is here. Now, when the pressure started coming, you see the meninges. It was only the meninges is the blue one, and these are the cartilages. Okay. You can't do reduce spinal cord through here. No. Yeah. So the meninges came out. The meninges is like a cushion surrounding the brain and the spinal cord. So that one will put, when the pressure starts coming up, there is no way you can jump from here to here without passing through this. Your meninges will come out first before the pressure will pull this one along, like we are seeing here. Okay. So when you get it like this, sometimes you are lucky you do cross. After all, my nerves are intact. But when the pressure pulls this one along, here is where the problem is coming from. You see, here is very tight. Ischemia. Ischemia at this junction. Ischemia here. This small junction where I've done the cross. You see the way it's tight there. Remember, these blood vessels, these nerves too has blood supply. So cardiorespiratory central nervous system you can't do without. Then later you add your lymphatics. to it. So here is tight. When here is tight, all the nerves from here to here, the cord, okay, caudal equina. So you see, this is your coccyx, and this is the end of the spinal cord. Here is what we call the caudal equina. Yes. So all the nerves from this junction to here, do you have a nerve here that supplies your bladder? You can't urinate again, okay? You need catheter because there is trouble here. Okay. Do we have a nerve here that is supplying your intestines? Trouble has come. Okay. Do you have a nerve here that will help your legs to walk? Trouble has come. Because of this, you're going to be paralyzed. Okay. That is the problem. So the higher the problem goes, a child who is born with, let's say, a missing bone here, did the parents see it? So this is the upper abdomen. So all the structures here will be in trouble. The legs cannot walk. The anus cannot poo. Okay. The bladder sitting on top will be in trouble. This is different from, so sometimes they get all these issues with, I mean, they are babies, so we don't have issues with autonomic dysreflexia that much. But when we do nervous system and we do trauma to the nervous system, where you learn autonomic dysreflexia, somebody has a neck. Somebody did not put on seat belt, car accident, brush, the nerve here, trouble is broken. When the nerve here is broken, remember, this is your chest cavity. The spinal cord is still intact, but this side is broken. So everything down below the injury will be paralyzed. This patient, if you don't intubate him or her, less than 10 minutes, they are out of this life. Because the respiratory, the nerve that is supplying the diaphragm here will be paralyzed. The nerve that is supplying the heart in trouble. Okay, heart even has its own electrical system, so sometimes it will compensate. But the nerves that are supplying the lungs in trouble. Yes. So in triaging, you will not prioritize the GIT over the respiratory system. Because if I get a patient like this, I know this patient can never poop, but poo will not save his life. It is the breathing. So I need to intubate or do tracheostomy. And I don't have to let this patient move the neck up and down. So I need to immobilize, put the cervical column. Yeah. And if I want to turn this patient from left to right, what do? I do log rolling. You can't go and carry somebody's leg and the arm. So you do log rolling like this. You roll them the whole of this length. Yeah. If you want to turn left to, you go here. You call it log rolling. Don't go and carry the legs or that you are doing Brzezinski or you cause more problems. So that is it. That is the act of science. Science is an act. Nursing is an act. Know your physiologists. Know your anatomies. Then apply the act. You'll be a good artist on the ward. And when cases come like this and you learn it, I mean, you see it and you smile. Don't go and be a nurse on the ward that somebody will slap you because you can't see emergencies. Your ability to detect that an emergency has come, and also makes you a gem. So that is it. Okay. Yeah. You protect the sac from positioning. It's very important. Like the child was lying down. Okay. I did not talk about. So this is prone. You can't put this baby at the back. You cause issues here. You put more pressure on this bulge here. Look at how the skin has bulged out like this. So imagine you putting your baby at the back with this problem. This is like David will say, this is common sense lesson. Then latest precautions. You do your latest precautions and all these ones. So when we meet the next time, you will do this. You continue. Okay. We have a long way to go, but be part of the story. Please. So we want to, like we said, we are now expanding our consult. Okay. Yes. So admins, when we made a decision that very soon, maybe on our next meeting, we will be doing live on YouTube. So instead of using the Zoom, we will all go to YouTube and do live so that it will populate it more, okay, for people to join. Yeah. So the next time on our meeting, and it's going to cut across with all our. So please, if you are not part of our YouTube community, subscribe to it. Ayariga will put it on the page. If you are not part of our WhatsApp platform, subscribe to it because we will be doing more sessions there henceforth. Okay. So please go and get subscribed and learn every day. I am teaching you not to write exams, but to become a good practitioner. And you have confidence in yourself. That's the most important thing in this life. Thank you so much. Okay. Yes, David. We will go over this topic again just for our own benefit. Yes. Those of you who want to become ER nurses, Ayariga has put the link there for the YouTube. Also add the WhatsApp so that those who are new here can join. So if you are not part of the YouTube community, go. When you go, look for my name. My picture is there. Subscribe. You'll be added to the community. Any announcement you hear, okay, any announcement you hear. Yes, so I said the digoxin, children survive with what? Heart rates. So whenever they have cardiovascular issues, especially heart failure, their ventricles are not able to pump blood out of their heart. Instead of going for, instead of prioritizing your blood pressure, you prioritize the heart pumping. Bang, 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 bang. Okay. Your children survive with what? Heart rates. They don't survive with blood pressure. They survive with heart rate. Get it? So if they give you two medications, a vasopressor and a cardiac medication, that will cause the heart to pump. For children, always go for the one that will cause their heart to pump. And if their heart is pumping, get it, you have given your patient who is a 4-year-old boy the digoxin to take. Yes, you want the heart to pump and pump well. Don't go, if you want to check the heart rate, don't go and do any concentrate on the apical pulse, your stethoscope. Your stethoscope, apical pulse. So is there when the heart rate is low, can we still give it on? Why not? What is the duty of the dozen? Get this.
I
Get
think
this
the
is asking.
I think the confusion is when we talked about adults, that when it's less than 60, you cannot give the digoxin. Does it mean that same rule applies to children?
Somebody should explain.
Because that's where the confusion is.
Yes. Who has the answer?
So, Aaron.
Yes. Betty, shoot.
So what Sir said is that when it comes to this issue with the child having low blood circulation, okay, and we don't need to for the child's BP to rise for you to know that it is the child. You don't need to do anything for the BP to rise in the cases of pediatric. So you need to check the apical, the heart rate. They survive more on the heart rate than the BP. So a child's heart rate is normally high. Okay, so when you give them the digoxin, it's okay, but we shouldn't look at increasing the BP in the cases of children. So that is what we say.
Okay. What else?
Hello.
For the
Question.
What is the work?
Ghana,
what is the work of the?
In Ghana, there's a reason why we have breast watches, and there's a reason why we count pulses. So if you are counting, the pulse relate with the heart rate. So if you are counting, and per minute you realize that your counting is more than necessary, you should know what it means. And if it is low, you should also know what it means. You get it? So this heart rating,
somebody should call. What is the relationship between the digoxin, heart rate, and BP relationship? Shoot.
Okay, thank you. So I think the digoxin will help the heart to contract, heart muscle to contract.
Because she has mentioned another.
Please, can I have a head?
Yes, boss, you can be heard.
Thank you. So I think what this would do, it will help it aids in to strengthen the heart muscle to contract well. So if it contracts, it will improve the cardiac output. Where Sir mentioned about ejection fraction. So if it's able to increase the cardiac output, it will improve the BP. But just continue to monitor. Thank you.
So increasing the cardiac, I've told you that children, yes, they are, we have something we call the positive and negative inotropy. Okay. The positive and the negative inotropy. Okay. So I have the muscles. Okay, let me start from here. Digoxin increases the strength of contraction, not the speed of contraction. What is the difference? Somebody should continue. The strength of contraction and the speed of contraction.
So the speed of contraction, meaning if it's the heart is contracted, let's say 5 times in a minute, the speed means it will increase more than 5. And the strength, like how it's able to harden is what I will relate with the strength.
What I understand is the speed might not necessarily mean that it is the speed might not necessarily mean that is the strength.
Okay.
You get it? It can be speeding, but it not necessarily mean that the strength of the muscles is there. It just trying to do anything to compensate, but the strength of the pumping is not there. That's what I'm understanding.
Good. So that is why we have a certain condition we call atrial fibrillation. When your atrium is fibrillation, AFib. So David, related to it. Continue your journey. I like your submission. Can you relate it to it? My atrium is quivering. Like this. So look at my fingers. Okay. Sometimes you check your heart rate. Heart rate is 170, 180. Atrial fibrillation, heart rate in an adult, 170. Why is it that we are always worried? David, can you connect your definition? You have a perfect definition, but can you connect it to this scenario? Are you there? Or you can't hear me? Any help?
I'm trying to connect, but if someone is there to also help, it will be good. I'm trying to do the connection.
Get this. Can you relate?
So I can relate to because the Jackson still I'm confused there. So
Okay.
yeah. Because okay, let me put it this way. If I am wrong, I know that digoxin also slows the heart rate. Is it one function of the digoxin?
It
Aside the
slows the speed, but that's what? What is the opposite side of the joint? The joint is like a double-edged sword. So people don't like using it that much. It's a double-edged sword.
so when we say the slowing of the heart rate, okay, I thought that slowing of the heart rate means if the heart rate is around, let's say, 170, it will bring it down to maybe 100.
Yes. I didn't hear what you said last, but I'll say yes. How about this? Curtis, are you there?
Yes,
Or
please.
you are okay. So you said your speed was at 120. The Johnson has brought it to what? 100. How about the strength of contraction? David, come and continue. David has the answer. Well, I don't know why he doesn't want to talk. Yes, what would the Johnson do to the strength of contraction? So that when you are
It will
given,
increase it.
Well, I think the digoxin will always strengthen the muscles to contract according to its speed.
so this is my heart. I have 1,000 mils in my heart ready to be pumped out. For some reason, I have heart failure. The muscles have become weak. Okay. So they are failing. Okay. So this digoxin will come and strengthen these muscles. Only the muscles will to pump boom like dynamite. Then it will push the blood out. Because when I get plenty blood in my blood vessels, volume is equal to pressure, Boy's law, remember. So if I get plenty volume in the blood vessels, my blood pressure will shoot. But they will tell you that when your heart rate is below 60 in an adult, don't give the Johnson. The same scenario, but before you gave the Johnson, your heart rate was below 60. Don't give the Johnson. Why? Because if you want to apply what Curtis was saying, if the Johnson was able to, according to Curtis' scenario, if the Johnson was able to move heart rate, the speed from 120 to 100, what will it do to 60? It will move it to 20. Yes. But on the strength side, it will cause the muscles to contract out. So the books will tell you that once you give the dozen to this small boy, because it is going to reduce the rate, because it's going to reduce the rate, always check if this is the chest of the child. Do your stethoscope. Check the heart rate. Don't waste your time to go and check pulse at the hands or the groin or whichever. Concentrate in the chest and check your apical pulse. Curtis, do you understand?
Yes.
Because you go and find a health worker giving the dozen and now go and put SAT probe on a patient's finger that you are checking pulse. This patient will die and you'll be standing there. Yes, the medication you give is a localized, is coming straight to the heart to work here. Is your heart in your hand? No. Is it in your groin? No. Okay. So if it is here, check the apical pulse. I want to know what my heart rate is. That is the most important thing. That is the most. Okay. So a child is 1 month old.
Hello, sir.
Okay. The heart rate
If
is 100. Will you give the chosen? Yes. My child is 1 month old. The heart rate, Curtis, are you there?
I'm there.
Will you give the Joxin for heart failure?
Yes, I will give.
Why? Explain. This is heart rate.
But okay, say
Which part of,
then you
before you answer this question, let me ask you this. Which part of the EKG strip do you check heart rate? PQ. Me, I like physiology. I can sit down and do physiology with you for the whole day.
The R. That's the yeah from the R.
So
At the
somebody
R.
is saying the heart. Okay.
Mm-hmm.
The R is part of what? The
It's part
R
of
is part of this QRS complex. What is the meaning of the QRS complex?
the
David.
child
Okay,
complex.
Michael is on board. Michael, explain QRS complex to class 5 child. Don't use any medical term, simple term. It is, I'll come back to you. You answer your question. Yes, anybody to help David?
It's a contraction and relaxation period.
Is that we shouldn't use any medical term?
Okay, okay, don't use plenty medical terms.
Okay.
Class 5 child. Class
Okay,
5
so,
is in school age. Oh, oh,
so
please.
I'll tell the class 5 child that for blood to move to your body, other parts of your body, that the lower part and then the upper part, your heart needs to pump blood.
Yes.
And I believe as for pump, they know what pump is. And the pump, the part of the heart that is doing the pumping is that's the particularly the left ventricle. So that's the ventricular contract. Yes. So the pumping like pushing the blood is the QRS complex. That is, and then when the pumping when it pumps, the time that it takes for it to pump again will be the what do you call it? Is it the SE something?
Okay.
And yeah,
Yes.
so the pumping.
So you'll be a good teacher. Yes, Lessons is saying ventricular push. Okay. You don't check heart rate or pulse when the heart is relaxed or when the ventricles are relaxed. You check it when the heart is pumping to the class 5 child. Okay, that's where we get our KRS complex. And the if the heart wants to pump, we call it QRS, meaning Q is starting from here. And this is S. That's the end. Okay. So the journey started from this Q and it ended at the S. But remember, it traveled up. So if you want to do number line like this in mathematics, let's go back to class 1. Number line or graph. We have the y-axis and the x-axis. And you see that there are some numbers here. Okay. So a baby who is 1 month old, the heart can increase. Okay. That rate, the spike, it can spike. The strength, it can spike to this level. Then the heart will go down. And then it goes back to the isometric line. So this is your rate. Of all this philosophy of physiology, that is where you check your heart rate. Okay. Go and target this point on your chest with your stethoscope. We call it what? Apical pulse. This same point, this is the human being. That's the chest. This same point, this same point, when you check it here, very close to the heart or on the heart, we call it apical pulse with your stethoscope. This same point, I don't want to check it here, but I remember that when the heart pumps, like is it David or Michael to his child, 5 years old, there is a radiation, there is a pushing of blood from this heart to the groin or to somebody's hand here. So in a good and a live patient who is very strong like you and I don't have to come to you with a stethoscope to check your heart rate here. I can equally take your hand, locate one of the arteries here, either radial artery or whatever artery. Press the artery against a bone. Okay. So when the heart pumps, boom, and please mute yourself. Okay. And the heart, when the heart pumps and the blood passes, I will feel it here as a pulse, a pulse. Yes, I'll feel it as a pulse. This is a radiated heart rate. It has traveled from my heart to my hand. But in that emergency state, forget about these guys. What if something blocked this blood vessel here? I'll get a false assessment. Assessment results. Okay, so again, the heart. I'm coming to you, Curtis. A baby inside the womb survived with a heart rate of 110, 216. But this mother has given birth to this boy, and this boy is 1 month old. Okay, that 1 month old will be still hovering around this heart rate for survival. So I came to this child, I want to give the Johnson, and I saw that the heart rate was 100. Remembering that anytime you give the Johnson, it will decrease the rate, but increase contractility. Curtis, will you still give the Johnson? You have muted yourself.
Nah,
I won't
I
give.
won't give.
If I meet Michael and I check Michael's heart rate, so I'll give the Johnson. Yeah, our time is up. Okay, we were even going to end there. I'll give the Johnson. Children is sick.
Yeah,
Fake.
say your screen is
Age,
off.
yes. Age specific. Age specific. Age specific. Age specific. The jaw is years old. Ask yourself, what is the normal heart rate of 5 years old children? If the heart rate on the low side, the Johnson will bring it further low.
Hello.
Hi.
It appears says this thing has disappeared. Maybe
Yeah, the network
it's
is not
trying to reconnect.
helping.
Let's exercise patience and whisper. Let's wait a bit.
So, guys, we've done a lot today. Let's call it a day. Then we meet tomorrow. Okay. So let's call it a day. Then we meet tomorrow. Okay. Thank you so much.
Yeah.
Any
Yeah. Hello,
questions?
sir.
Yes, sir.
Hello, sir.
Mhm.
Sorry, but concern the Dugosen, we explained a lot of issues surrounding it, but I just want to know at which point can we actually give? Is it when the heart rate is high, we can still go ahead and give, or when the heart rate is low, we can still go ahead and give, so that we will
When
draw
the heart
that
rate
distinction.
when the
As
heart
far
rate
as
is high,
the children, yes,
so you want is age the word is age specific for children.
yes, 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 for children, and then that of adult, is it that one is high we give, so that we will draw
60
that distinction, and
adult
we'll take home with it. Yes,
bradycardia
adult,
is below
uh,
60.
uh, yes, yes, so that we know. Thank you, sir.
Yes. So when you check somebody's heart rate as an app and you get 60, don't give the dozen. Because the dozen will reduce the rate. Though it will give the muscle of the heart strength to pump, but the rate it will reduce it.
Sir, are you referring to adult?
Yes. I think it doesn't does. I don't know if people are catching the physiology of the digoxin. It
Yeah,
doesn't
your
that
network is
proteins.
breaking up a bit. Sorry, I don't know if it is wrong now.
Let me see if I can connect with my
Mr.
phone.
Mr.
Because we are
Bright,
almost done. Yes, mom.
Mr. Bright, I think he wants to know the rate at which you can give in children. And I remember we answered that you can give it at 9. You can give it. No, you shouldn't give it when it's 90 in babies and then 70 in children, and then the adult is 60.
Yes.
I think that's what he wants to know.
So that's what Bright was saying, that it's age specific in
Age
children.
specific,
Yeah.
yes.
So the heart rate of an infant is different from the heart rate of
From that of a child, yeah.
a toddler and a child. So if
Okay.
it's
Yes.
below the normal, you don't give.
Okay.
I understand.
Thank you. Thank you.
It's actually 90 for the babies and 70 for it's actually 90 for the babies and 70 for the
So
children.
does
And the
that mean that
adult,
when the heart rate, so when the heart rate is 60, you shouldn't give. Is that what I understand?
Please come again.
I'm asking whether when it is an adult and your heart rate is 60, we shouldn't give digoxin. Is that what
Yes, you
I'm
don't
getting?
give. Yes. it should be more than 60.
Is that the answer? Good. So that means when the person is getting
You have two devices. One has
that's why you are supposed to give the government, right?
Yeah. So when sorry, I think it was me. So when the heart in adult, when you check heart rate is less than 60, don't give the Johnson. But children is age specific. Okay. So that is what you should know. Your duty. I know you can't just get up and say, I want to give the Johnson. At least go to know the good or your hospital policy on children and their heart rates. It's part of the slide. We will get there. I don't know whether we have done it already or not. So the ages and their heart rate or their vital signs. Okay. Yeah. Please, do you understand?
Thank you, sir. Thank you, sir.
Yes, please. Thank you so much.
I get you, sir.
We every day physiology is not static. It is anatomy that is static. So physiology research is new things are always coming up. So anatomy A is A. But physiology always have to read so that you better yourself. Okay. Thank you so much, guys. And stay safe. So we meet tomorrow.
Okay, thank you, sir. God
Okay.
bless you.
Thank you. God bless you. God bless.
Okay.
Sir,
Okay.
please, I've sent you a message. So kindly check.
Okay. I'll do.
Thanks. Bye.
Okay. So I'm out. I made you the host, so you can close the class.
Sir, please, the message I sent you WhatsApp. So that you share WhatsApp.
Oh, okay. Is it now? Because I'm not seeing anything. Which you send it to me on my US line, because that UK line is gone. I don't have access to it again.
Which line in
The US line 575-495-387. I use it to. I posted the link, the Zoom link with it on the page today, so you can.
All right, thank you so much, sir. God
Okay.
bless you too.